Viewed from above, the white, blue and red plastic sheeting dot the Port-au-Prince landscape. Camps are everywhere, sheltering people who lost their homes in the earthquake 6 months ago. The number of homeless is estimated at 1 million. Today, however, despite weeks of rain, they cannot or do not want to go home. They still fear that the earth will move again.
We
have patients whose houses resisted the earthquake, but they are incapable of returning to their homes. They avoid the area.
Médecins Sans Frontières has been working in Haiti since 1991. Today, the non-governmental organisation employs more than 3,000 people, including Haitian and international staff, and works in 19 health facilities.
I don't think we've ever seen anything like this. We've never seen so many deaths and so many wounded people who need immediate care, especially surgery. We've never seen that. The population density, an earthquake striking the heart of a city like that, a very poor city, yes, this is a unique situation.
Over the last 6 months, the MSF teams have provided emergency medical care to more than 173,000 patients and performed more than 11,000 surgical operations. 140 people have undergone amputations.
Our main job as physical therapists is to prepare the stump, to desensitize it, give it a shape and strengthen it, and then work with Handicap International on the prosthesis.
Before the earthquake, the Médecins Sans Frontières teams provided obstetrical care and functional rehabilitation, as well as treating knife wounds and road accident injuries. Those activities continue.
Today we face the same health problems as before the earthquake. We're going to try to set up hospital facilities for the poorest people, facilities where they can receive care over the long term. We're trying to plan for hospitals for 10 or 20 years into the future.
Between January and late May, Médecins Sans Frontières received more than 91 million euros in private donations earmarked for emergency aid to Haiti. More than half of that was spent in the first 5 months of the response, the largest ever in MSF's history. Today, MSF is gradually shifting its services out of tents into semi-permanent facilities. The Sahel is experiencing another serious food and nutritional crisis. The situation is recurrent in this region, but conditions are particularly severe this time. Approximately 10 million people are or will experience food insecurity because they lack access to food. Families are finding it increasingly difficult to provide very young children with an adequate diet, especially animal protein. Children under 5 are the most vulnerable. When they do not receive nutrients essential to their growth, they suffer from malnutrition. Here in Niger, more than 1.5 million children could develop malnutrition this year. Hassan here is 3 years old and weighs just 5.3 kilos.
For those who arrive in a life-threatening condition, we provide care appropriate to the various stages. We can provide intensive care with very close monitoring. Some children arrive very, very late. We don't know exactly why, but the families are slow to bring their children in. They arrive in critical condition, and we can't always save them.
Médecins Sans Frontières is treating hundreds of children in Niger. Like Hassan's mother, many families come from as far away as neighbouring Nigeria.
Upon admission, as you can see, she is weak, really apathetic. This child is very unresponsive. She's got severe dehydration.
In addition to providing treatment, MSF tries to prevent malnutrition. The teams are preparing to distribute nutritional supplements in the areas where they work. Médecins Sans Frontières is also working in Chad, where the organisation has decided to increase its activities since the country receives less aid from international relief bodies. Rain is infrequent and harvests are poor. This has led to an increase in food prices and supplies are running out. In addition to that, the population has limited access to medical care. In the Hadjalamis region, 5% of children suffer from severe acute malnutrition and are in danger of dying. The organisation identifies those who are already ill at outpatient feeding centres and refers the most critical cases to hospital.
We currently have 15 outpatient feeding centres. We have admitted 1,200 children with moderate or severe malnutrition. Every day, the 3 teams travel between the different centres in order to see all the children. They weigh them, examine them, and provide the families plum peanut and food.
MSF is also working in Mali, Burkina Faso and Sudan. After a nearly 2-year forced suspension of its activities, MSF's French section has been authorised to resume its work in Niger. In June, violent confrontations plunged southern Kyrgyzstan into chaos. According to official reports, the several days of fighting left 312 dead, but this figure is known to be largely underestimated. Thousands of people were injured and many others fled. Médecins Sans Frontières has been working in the country since 2006 on its tuberculosis treatment programme in prisons. The organisation's teams were therefore able to reach the Osh and Jalalabad region quickly. They have been providing medical care and psychological support to people affected and displaced by the fighting.
We ran away or we'd have been killed. My house was burned down. That's why I'm here. Now we're homeless.
MSF teams are still working in the region. They use mobile clinics in an attempt to reach isolated populations who do not have access to medical care. Many people were traumatised by the violence and are experiencing psychological problems.
The psychological needs of the entire population are obvious, whether displaced, refugee or local, whether they left the city or not. As soon as we speak to people, even asking something as simple as "How are you?" they start crying. They also need to tell their story, so the needs are there and they are very obvious.
MSF psychologists have so far provided care for 200 people. They are also training counsellors who will lead support groups in the communities. Thousands of people have returned to their neighbourhoods, but some are still displaced, scattered along the border with Uzbekistan. Tension between the communities remains high. Those who fled their homes have lost everything. Médecins Sans Frontières is distributing hygiene kits which contain soap, cooking utensils and blankets. To help local hospitals deal with the situation, the organisation is providing drugs and medical supplies and is training staff.